as a big warning, and this is just a warning to you in general, don't post any recalled NPTE or NPTE PTA questions on the course whatsoever. As a matter of fact, you need to stay away from them completely, because the Federation does have private detectives that look at sites that are posting NPTE questions, and they look to prosecute both the people that are posting those NPTE questions and actually the people that are viewing them as well. And they may deny you permanently the ability to take the exam if they catch you on those sites. So that's something that they really take fairly seriously. The other thing is the Federation's getting darn close to the point that they're pre-testing a question, and then if it passes pre-test, using it as a scored item on an exam, and then discarding it after that. So they're not really exposing the questions anywhere near what they used to do about 5-10 years ago. They used to reuse questions over a long period of time, and I've been in a lot of Federation meetings. They always had a consultant coming in saying, you gotta not be continually using the same questions. And that was a problem they have that they have really strived to correct, and they pretty much got it corrected. The same thing sort of goes for practice exams. Although most practice exams are more questions like you would see in school tests, a lot of them are. Even the PED exam, the first exam there is more of an academically oriented questions, more like what you'd see in school. And the feedback you get from that exam is more what textbooks to pick up and study. The second one in the PED is comprised of retired exam questions. And it does make you think the way the exam needs to. The problem with the PED and the one currently that you could buy from the Federation is even from the old content line. It's exam questions that were used during the 2013 cycle. The one that comes out next May will have ones from this year's exam cycle. The questions are coming from this year's exam cycle. So it'll be more up to date, and it's actually to the content line that's currently being used. Although the change in the content lines have been fairly minimal. I sort of like the new content line. It's a little bit better than the one that was being used. So I'm a little weird PT, and it's actually good for the NPTE because you get people in all these specialty areas writing questions. And I have really dabbled in most of the specialty areas around. I've done a lot of foot orthotics, definitely a lot of wound care. When I was at the acute hospital, I developed their cardiac rehab program because they didn't have one when I walked in the door. When I walked out, they did. And then they actually asked me about 10 years later to come in and revise the program because American Heart Association had changed a few of the parameters, and they added the level 2 was added, or the phase 2 cardiac rehab was added at that point. I have also been an exam writer. I've sat in the exam writers workshops many times and gone through that. So I do know how to write the exam questions, and that's sort of important because it really, if you can figure out why you wrote the question, you can figure out what the answer is fairly easily. It'll point to one of the answer choices. And that's one way. If you tend to go too fast through the exam, simply read the question and sit back and say, why did somebody write this? Because each question's about a theory. And if you can identify what that theory is, it'll point to just one of the answer choices. So it's one way to sort of help you through the exam. You should always know why you're doing things as well when you do something to a patient. When you apply a test or you apply a treatment, you should know why you're doing that. Not the point that you have to have reference sources to justify it necessarily, but you have to have that logical train of thought as to why you're doing things. And they're looking for that ability on the exam. Thinking is definitely required for this exam. You've got to think your way through it. It is not a recall exam. The first thing with this exam, as far as how you're studying, needs to be different than how you studied in school. In school, you're often studying to remember what the facts are and what the buzzwords are, the terminology and things like that. You do need to know the terminology. You do need to be able to recall the facts, but you need to be able to recall them to the point you can use them to develop a treatment program or implement a treatment program with a patient. So you need to take it more clinically. You need to sort of approach it more like a clinician would than academic would. In school, they tend to focus more on academic. Like they like to know what references and things like that. Not in this exam. They're looking for the best decision too. One answer choice is clearly better than the other ones. Maybe the term correct may not be a good way to state it. They're looking for the best choice. In the situation they give you, it does use current evidence. Current being about 5 years old. Anything newest and greatest hasn't made it to the exam yet. And things that are new and great, a year or two later are no longer new, and they may be not that great too. Usually when something's brought out, when it first comes into focus, there's not a lot saying it's not that good. And usually somebody promoting something has done some research showing positive effects with it. But then later on, other research sometimes shows some negative effects as well. So really, it takes about 5 to 7 years for something to get into a textbook. Best evidence, really, your textbooks are pretty good. They're actually fairly well reviewed by the publisher before they're published. As far as the content, it's actually reviewed in. NPTE courses are not necessarily reviewed for content. So they're not the greatest, and they don't go through quite the level of review. I would say, actually, Score Builders does go through a pretty good review because they're actually through a national publisher, but the other ones are not. The NPTE uses what's called accepted evidence, which means it's been around a while, and generally people agree with it. The strongest evidence still, though, is coming out of the foundational sciences, anatomy, physiology, some biomechanics in there, and really the pathophysiology that you see with disease. Basically, you need to know how the body works and how pathology screws it up, and how to return it as close to normal as possible. You can never get somebody back to 100% normal usually, but you can get them back close to it. Although sometimes after injury, like an athlete may get actually even more motivated and actually may have better performance after the injury than they had before. You have to be strong in these areas. For physiology, I've seen that it's sort of being downplayed in a lot of schools nowadays. They sort of replace physiology with pharmacology instead. And it's impossible to really understand pharmacology without knowing the physiology and how the drugs affect the physiology too. So they really need to teach both, but they sort of drop the physiology component. I've had some students with a real deficit in that area, and I gave them something called the Physiology Coloring Book. Capit is the illustrator for it, so he's listed as one of the authors. You can get it on Amazon. It's by Olympic Press. Not exactly new, but it's actually really good, and it's really cheap. Good and cheap is unusual. The Human Brain Coloring Book by Diamond is in the same group of books too. There's also the Anatomy Coloring Book, also by Olympic Press, in the same group. The Anatomy Coloring Book probably is not complex enough, but it does give you certain issues that you don't see other places that well, like the effect of first, second, and third degree levers and things like that. That has shown up on the exam before. So it's not bad, but it's not, you need to have more in-depth than that. But your anatomy needs to be really strong. Physiology needs to be fairly strong too. You have to understand what diseases are doing to the body. And a lot of the pathology books don't deal with the effect of exercise and that particular pathology. They're written more for physician's assistants and nursing than they are for PT. But you can sort of extrapolate the effect of exercise on them. And I would think about both aerobic and anaerobic exercise and the effect of those two. Because the effects on the body of aerobic and anaerobic are quite different on the physiological level. And thus pathology is going to have different effects on pathologies as well. Also, too, when you read about a test, you read about something, try to take it down to the anatomical level. Like a special test, when you put that force through, what structures is that actually stressing that gives you a positive result for that test? And it's usually what the test is for, but it could be other structures as well. And that's where you start seeing the error that you see with some special tests. And usually when we do testing, we do more than one test for something. You want to have several tests that look at something slightly differently that all come out with the same result. Then you can say they actually have that problem. We also test patients to see both what their problems are, and then once we have identified the problems, you need to sort of quantify it. So the identification of problems is more of a qualification there of what problems they have. It's a qualitative type approach. But then you start, once you've identified what the problems are, you need to know how significant they are. Then you use more quantitative tests to see how severe the problem is. And we test things that would affect the treatments we're going to give the patient. We're always really evaluating a patient to try to determine their best intervention. PTAs sort of have the same issue. You do it a little bit less intensely, but oftentimes PTs just say therapeutic exercise, period. That could be anything from passive range of motion to manipulation to active exercise. You got to determine what and what type of active exercise. It's going to be isotonic, isometric, etc. What would be best to solve that particular problem that the patient's presenting with at the time? And they often give you a certain from the details they give you in the question, you can see where they are in the progression of a pathology sometimes as well. Those pathologies are usually acute, and then they go into a subacute, and then a chronic phase. And where are they along that continuum? That would change what type of intervention that would be best to do for that patient. The NPTE doesn't really get into things that are controversial because it's not totally accepted. They try to not write questions about a particular technique either. They don't want to promote somebody's technique over somebody else's technique. So they stay away from that. Exercise, really the only technique they describe is PNF, and you do have to know that because a lot of other therapeutic exercise programs are based on PNF. NDT exercises are based on PNF. Feldenkrais exercises are based on PNF. They just expand on a little bit. Muscle energy is also related to PNF as well. Muscle energy techniques are more for orthopedic type patients. It is about accepted concepts and theories. And usually when somebody's writing a question, they start off with a concept and theory, then they develop a patient care situation to have you demonstrate your understanding of that concept there. We really harp on the exam writers to write questions that show somebody understands something or that particular concept. Really seeing how you use your logic to be able to put all the facts together they give you in a question. Now, when they write questions, they're told not to include any facts that don't lead you to the best answer choice. If the age of the patient doesn't make a difference, they shouldn't put it in the question. And actually, the reviewers would probably kick it back to the person who wrote the question saying, take this out, if it doesn't lead to that. The sex of the patient also may or may not make a difference. Like someone with MS, yes, you see a lot more MS in females than you do in males. And you see it in females at certain age brackets. Males, it's not so much in the age brackets. You can see start of MS even in teenage and male, and you can see it really starting up even early geriatric in males as well. Females is usually mid to late 20s with the onset. Parkinson's is more males. So giving a male or a female a question about those diseases might be a clue as to what the problem is. On the PT exam, they usually just give you signs and symptoms. You need to sit back and sort of make your likely diagnosis of the patient. You sort of need to know what's going wrong with them to be able to get the intervention. So you really won't have questions as to what diagnosis is this, and the answer choices being different diagnoses. You may have a question more like, what test would be positive with a patient with these signs and symptoms? PTAs, they will give you the diagnosis to work from. And when they give you a diagnosis, it'll be accurate. PT, they may give you a diagnosis that is not accurate. Carpal tunnel syndrome is a classic. And to a lot of physicians, if anything's tingling from the elbow to the hand, is carpal tunnel syndrome to them. There's many different problems that mimic carpal tunnel. I've had patients diagnosed with carpal tunnel where they're tingling on the back of the hand. That area is innervated by the radial nerve, not even the median nerve. It's not carpal tunnel. Definitely ulnar problems can imitate carpal tunnel as well. And there could be entrapment of the median nerve around the elbow as well as at the wrist in the carpal tunnel. There's possibilities for all that. history sometimes makes a difference. What caused it? What were you doing the day after you started feeling, or what were you doing the day before you started getting symptoms? That sometimes implicates what caused it as well. Usually symptoms are a lot worse the next day. This Bloom's taxonomy really says where the exam is and where school tests are. School tests are really heavy in this remembering thing. They're really what is going on. They're really easy to justify when you write a test with a lot of questions like that. They're asking you to remember facts that were probably in textbooks or in PowerPoints that were given to the students. So it can really be really easily defended. A lot of the tests you have in school, the really defensible ones, are ones that are asking you to remember things. Understanding isn't quite as easy to defend. They are trying to teach you a little bit about understanding how things work and how this pathology screws things up. So they are trying to get in there, at least in the lectures, but they're probably testing more on the remembering. The exam is really asking you to analyze the situation the patient is in. They're asking you to evaluate the different factors that a patient presents with, how significant they are, and really being creative in putting together a treatment program for the patient. They're really asking you, the NPTE is pretty much up in this area, whereas school's down in this area. So it's really a higher level of understanding that you need to be able to do that. You almost need to have mastery over the theories and things like that. You have to be able to apply a theory in a different situation than the textbook presents it in. So you have to really analyze, you have to really apply your knowledge through analyzing and evaluation of the factors, and then being able to come up with creative solutions for problems. And that's a skill to be able to apply your knowledge. You need to read the questions carefully. Every fact they give you in there does make a difference. Very long questions, you may want to use your scratch paper or scratch tablet to just jot down some of the facts. You don't have to write them out completely, but just do some easy, quick notes. And sometimes those bring the facts out more to you to make your decisions from. It's sort of like highlighting things. They're really after that mental skill of you being able to use your knowledge on this exam. That's what they're trying to see if you have or don't have. Because that's what actually helps a patient or doesn't help a patient. That's the reason for giving the NPTE, is to find out if you can be an effective practitioner. And the Federation's using the term just effective. They used to use safe and effective. Now they just say effective. We've got to think a little tangentially on this. And my webinars will go off in tangents sometimes, but the exam questions do that too. You have to be able to logically go off into a tangent sometimes. And they're looking for that. You got to synthesize what's going on with the patient, even where you are. If you're in an acute hospital, you're in acute rehab, you're in an outpatient clinic, you're in home health, there's different things you can do in those different settings. So your intervention would actually be different based on where you're providing that. When you're writing goals, even long-term goals, are best written for the facility you are in. Usually they're the criteria for discharge from that facility for you. When we discharge a patient, we really transfer the care to somebody else. If you're an outpatient, you discharge a patient, you usually discharge them with a home program. So you've turned over that responsibility for treatment to the patient themselves then. But you're always transferring that care to somebody else. working in a hospital, an acute hospital, is to get them out of the hospital and get them somewhere else where they can continue the rehab. So the NPTE is really it's a test for a different purpose. It's trying to decide whether or not they should give you a license or not. And they want to give you a license if you can be an effective therapist. That's really what the CUT score is all about. Each exam itself has a different CUT score to it, which is how many questions of that particular exam they would think that an entry-level therapist should get. We're always expecting more and more out of entry-level therapists. So the exams are always getting a little bit harder. We try to correlate to the most recent exams. PTs are probably going to have a little bit more in the outpatient setting, more pediatrics on the exam. You will have some geriatrics as well. Geriatrics and pediatric patients are usually fairly complex as well. PTA shouldn't be dealing with that. More complex patients should be treated by the PT, less complex patients more by the PTA. Development is something you always have to think about with a pediatric patient. Because what's wrong with them, your intervention could affect their development. With PT, you got physical therapy examination, a fair number of anatomy questions could be in here. Definitely how to do test and measures are here. We also have a set of questions on interventions. Intervention questions on the PT exam often starts off with signs and symptoms. They may not give you a diagnosis to work from, and if they do, it may not be an accurate diagnosis. So they give you something like sciatica. Well, you know the sciatic nerve's being irritated, but what's irritating it is what you have to find out to correct it. This system for foundations for evaluation is more about which tests would you select to use for a certain problem. It also goes into how accurate the tests are too. What can cause error in certain tests? You generate more false positives or false negatives as a result of that. And that tells you if it's a more specific test or more sensitive test. They aren't asking you for sensitivity numbers, because that doesn't really tell you that much. But different factors could possibly cause an error. And I'm more after you to sort of know what those factors are. Edema makes a big difference. Like you won't get a McMurray click test if somebody has edema in their knee, because it won't click. Once the edema has resolved, usually about 2 weeks post-injury, like for a meniscal tear, then you'll get a click. If you examine them right after they tore the meniscus, you'd probably get a click too. Got a window of about 10 minutes to see them and evaluate them. That's why sometimes you'll see the orthopedic surgeon running out on the football field and examining the patient lying on the field. And sometimes a special test can tell you a lot. And they actually tell you a lot more than MRI does. But you sort of want the special test telling you the same thing the MRI does. And maybe would lead to what would you look at in the MRI as well. What particular slice level, things like that you'd be interested in looking at the radiographic MRI. PTA, they will give you a diagnosis to do an intervention from. They may also give you some test results that would tell you how significant certain problems are, which means you have to take that into account in devising your treatment for the patient. One thing PTAs have always been able to do is to adjust the intensity of treatment. Still should try to stick with the basic care plan that has been written by a PT, but often the care plans are fairly vague. And they're done that intentionally to allow the PTA to have more freedom to do things. You sort of want to be thinking the same way the physician is. You want to be in agreement with each other. If you're not, that's a good time to refer the patient back to the physician. For PTA, physical therapy has to be provided underneath the supervision of a physical therapist, because basically once the eval is done and the patient's turned over to and they usually have to sign the discharge summary as well, but oftentimes it's co-signing over the PTAs. Physical therapy, instead of the evaluation section, has data collection instead. It's still the same test and measures. It's very similar. There's some anatomy and physiology here as well. Diseases and conditions is the other section, sort of like the foundation for evaluation for the PT one. The different pathologies are there in both of them. It's not so much selecting the test and measures. That would be in the data collection section there. So that is a difference with how the two are laid out. And the interventions are very similar, except here they actually give you a diagnosis to go from. Patients themselves always present with a variety of issues, not just one usually. And when you're developing an intervention, you have to take into account all the significant problems a patient would present with. Significant being it would affect your intervention. The intensity of the intervention or the type of intervention you use may have to vary due to the problems the patient presents with. Issues and questions come from several different sources. On the PT exam, there's usually about 3 to 5 different facts, different issues in each question. So you always have to sort between multiple things. And they actually sort of go through multiple systems sometimes in a question too. You may have a neurological involved patient, which also has a musculoskeletal problem. PTAs have 1 to 3 issues in questions. Very few one-issue questions. School tests are usually a one-issue question. On the exam, PTs will never have a one-issue question, and PTAs aren't going to have very many of them. They're usually closer to 2 to 3 different issues in each question, too. Your textbooks are probably your best source, or at least your first source to go to. You can go through research as well, like the Physical Therapy Journal, Physical Therapy, or actually the section journals as well. Most of those you can access through the internet. The new ones will never show up on the exam anyway, so don't worry about them. But usually things going 2 to 3 years old, yes. You need to know the scope of practice. And you need to know the scope of, like PTs need to know the scope of practice for PT, but you also need to know it for PTA. And PTAs, you need to know it for PT too, because you sometimes refer a patient back to the physical therapist. Once you've actually taken the test, you've got to read carefully and really understand the situation you're in. Once you understand that situation, you have the basic framework to make decisions from. You got to look at each one and sort of analyze them as far as what outcome they would have for the patient. And the idea is to select the one with the best outcome, which means probably the least risk and the most benefit. And there's that risk-benefit ratio that you have got to sort of think about and determine which might be the better course of action to take. And that's actually how you make a clinical decision. And that's what they're really asking you for. There's usually one factor in the question that would make one of those better than the other. And maybe it's not the major fact in the question. It's maybe some of the minor ones, like the secondary diagnosis, not the primary diagnosis, that would make you change to one of the answer choices. When you're taking the exam, read them, pick the best one, mark it, and move on. Do not mark the question to come back to and review later. You're just torn between two answers. Sometimes they'll pre-test a bunch of questions over an area just to see if that's entry-level practice or not. If a lot of people get it correct, then that says that's being taught in school and it's entry-level practice. Do not mark a whole lot of questions. You probably should mark maybe 2 or 3 in the whole exam. When you're studying things, it's not just memorizing the facts, it's trying to understand what they mean. If they give you a laundry list of signs and symptoms, for instance, put them in order, because some of those signs and symptoms are related to the same system, and they may be more significant or less significant type symptom, but try to put some order to that and try to make some logical things instead of just memorizing things. When we do an intervention, we probably need to address their chief complaint, and this sort of takes priority. If possible, you need to address that. Sometimes it's not possible, but most of the time it is. But then you got to take the secondary diagnoses into account as well, maybe with the intensity or how I go about addressing that chief complaint. So you really have to analyze all 4 answers to really see which one is best. Just don't go down and take the first one that looks right. Really, when you're studying, try to figure out why things are happening. Breaking it down to that anatomical, physiological level, and then bringing it back up again. But in analyzing things, you break things up. And you break things up into those anatomical and physiological components. Like function impairments may cause a decline in function, but you need to find out what the impairment is. It could be range of motion, it could be strength, it could be endurance. Those are actually the impairments. So studying for the NPTE does take a lot of reading, but you also got to analyze what you're reading too. You got to read something and sit back and think about and analyze it. Try to see why things happen. If you want to put a motivator in front of you, just write why in real dark letters and post it up in front of you where you're studying. That's what you need to be able to see. We always should know why we're doing something to a patient when we do it to them. And the strongest evidence does come from those foundational sciences. So you got to break it down to that level usually as you're studying. As far as the study schedule, try to study for at least 2 hours a day. If you want to study more, it's probably better to break it up in 2 to 3 hour blocks. Maybe do a block of studying in the morning, get up early, do one before you go to work, do another one when you get home from work, particularly if you're not having a webinar that night. Try to study every day. Don't necessarily take days off. It's really hard to get back in the routine again once you break it. It's better to get a good routine going of at least 2 hours a day. But you can train yourself to be better. And studying once or twice a week for a longer period of time will help train yourself to do that so you don't fall off in that last block. Really push yourself to fully understand concepts and fully understand how to use a concept. Once you understand things, you have a tendency not to forget it either. The retention is much better as well. You need to be able to see why things happen. On the FSBPT website, There's also a textbook survey. If you want to know what textbooks are being used in school, maybe feeling like you need to improve your library a little bit, you could look at that survey, and it actually gives you the textbook and how many programs are using it. There's different lists for PT and PTA as well. Although some textbooks are being used by both, like McGee is used in a lot of PTA programs along with a lot of PT programs. When you're studying, take notes, and actually handwritten notes, sometimes a little bit better because of the kinesiological input of handwriting tends to get better retention going on with you as well. During these webinars, have a notebook there. Start taking notes like you were taking notes in class. It really helps you understand things better. Then maybe go back over the webinar and fill in your notes a little bit more. Some stuff you sort of missed. The key to success is studying, and it's got to be consistent. Most experts say it really takes about 3 months to totally prepare yourself for this exam. You've got to at least get into each area on the exam. Don't cram. Cramming just leads to more error. It also ups your anxiety level quite a bit too, which if you're really anxious, you can't make decent decisions. Before you take the test, the Sunday night before you actually take the exam, that's your last night to actually study. The Monday and Tuesday before the exam, I would just take off and rest. Make sure you've gotten good sleep. Make sure you know how long it's going to take you to get to the Prometric Center at the time you need to get there. Try to be there about 15 minutes before the exam starts, maybe 15, 20 minutes, somewhere in that time frame. Make sure you have a meal before you actually go into the exam as well, so your blood sugar isn't dropping during it. And actually, more protein in that meal might be a little bit better idea, because just get ready to analyze the daylights out of those questions and the answer choices. Attack the questions as, this is a patient in front of me. Okay, let me understand the situation I'm in. Then go look at the answer choices. And what would happen if I did A? What would happen if I did B? What would happen if I did C? What would happen if I did D? And pick the one that both answers the question and gives the best result for the patient. It's not the most efficient. It's not the cheapest. Those aren't considerations there. It's what's best for that patient.
So they're trying to get you thinking the way you need to think to pass this exam, which is sort of different than a student would be thinking. Good night, all. Bye-bye.